My name is Virginia Ladd. I'm founder and president of the American Autoimmune Related Diseases Association, also known as AARDA. Step therapy usually is part of normal guidelines in treating a patient because you would usually start out with the least toxic type of treatment and then move up to more potent drugs as you go along. So that's actually a good practice. However, when it's not a good practice is when insurance companies impose on the physician and the patient that they must start at step 1, when that patient may require immediate step 3 because of the involvement of their disease. So it can be very serious for that patient to start out on a drug at step 1 when they actually need step 5 in order to preserve their organs, such as the kidney, the heart, or the lungs. I work primarily with patients with autoimmune disease, and these can be serious chronic illnesses. So they're not diseases that you can cure. So it's not like an infection. You take an antibiotic and the infection goes away. These last a lifetime. So they can range from very mild and can be controlled with very mild therapies in some cases. Other cases, they can be very serious. They usually become more serious when major organs are involved, such as the gut, such as the heart, the lungs, the kidneys. So usually you have to intervene a little bit more aggressively in patients that have autoimmune disease with organ involvement. The practice of step therapy can really interfere with the doctor-patient relationship because the patient selects the doctor based on the doctor's knowledge, based on the doctor's certification as a specialist in the field treating their particular serious disease. So when an insurance company comes along and tells that patient they cannot have the medication that that specialist wants them to have, that breaks down the relationship between the doctor and the patient. That should be one of trust. That's why the patient selected that doctor. And when you have people that are not trained interfering with that decision, then that's very frustrating to the patient. If I was advising patients who are struggling with step therapy, I would say you have to become your own best advocate. You have to be persistent and you have to be patient. And you have to understand that you are right. You deserve the medication and access that your trained physician and your specialist determined you needed.